Time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Well, hi. Here we are, right after Christmas, and we're getting ready to roll into the new year. And it's just, I don't know about you, but I cannot believe how quickly 2012 went. And I'm looking forward to having another great year of PetSylvania and work at Sylvania Vet. I love being a part of the community in Sylvania, and it is a great place to work and live. Of course, I would like to thank Elanco, makers of Trifexis, Comfortis, Reconcile, and other high-quality veterinary products for their sponsorship throughout the years since we started PetSylvania. And, of course, Sylvania Vet, which is my business, that is sponsoring me as well. And I always try to tell you a little bit about the many things that we do at Sylvania Vet. And I keep coming back to wanting to remind you about the American Animal Hospital Association and their standards. If a veterinary hospital is not an AAHA certified member, that hospital is never inspected by anybody for standards. And so the 3 hospitals in the area that are certified meet over 900 criterion for excellence in care and record keeping and hygiene and housekeeping and laboratory work and all the communications. The AHA emphasizes all those things. And it should be reassuring to you to know the AHA is out there and that it's looking out for your pets, because as a member, their care is the most important thing to us. And so it's a major commitment that we make. Been a member of AHA since 1978. So that says a lot about our 100% commitment to you and your pet. The other thing that we constantly want to emphasize, and it just seems like it's amazing to me, the number of people that don't know that Sylvania Vet is not only a full-go general veterinary practice during the day, but that we offer emergency care and that we're available overnight with a doctor on call. And every one of my doctors that's on call lives within 15 minutes of the hospital, even at rush hour. And so if they have to be called in, they will be there, and they will be there for you, and they'll be there for your pet. And again, we charge regular fees, with the only exception being a one-time for each emergency, $65 emergency access fee, and that's what brings the doctor in. It's what gets you in the building so that our overnight staff can assess your pet and decide what's going on. The rest of the time, we've compared fees. We're about half the cost of the local emergency service for most of the charges that are commonly used. We'll be happy to take and manage the case from beginning to end, or after the emergency, if you want to have it go back to your regular veterinarian, we're more than happy to communicate with them and send the pet back and send copies of the x-rays and the records so that they can then take over the care of the case. So it's your pet, you drive the bus on that, and you tell us how you want it handled, and we'll be there for you. It's not uncommon for a dog to break one of the big canine teeth. We're confronted oftentimes with the decision as to what to do with that broken tooth. Certainly it can be extracted, but particularly the lower canine teeth, when you extract those, you're removing, by the time you get that tooth out, you've removed about 70% of the mandible, the bone of the lower jaw, and it dramatically weakens that bone. And so we like to save that tooth if we can. And so one of the services that we offer at Sylvania Vet is that we do root canals. And right now, primarily, we only do root canals on those single-rooted big canine teeth. And I've had some experience with trying to do root canals on the multi-rooted teeth and back. There's so much force from them crunching and chewing that the root canal teeth just don't seem to hold up. But the canine teeth, when root canals are done, they keep up the space. They keep the teeth from migrating. They keep the occlusion, so that's how the upper and lower jaw comes together. together, we that all stays in place, and as a result, the dog stays healthy, the dog or the cat. And we've done it on a ferret a few times as well. We think it's better to, even though you spend a little bit more money on a root canal than an extraction, it's less painful for the animal and it's healthier for the animal long term. So you want to try to save that tooth if you possibly can. Now, there are some situations where the tooth is shattered or it's broken well below the gum line. You just can't save the tooth, and then it needs to be extracted. We had an interesting case this week that it just doesn't happen very often, and that is we had a female cat that came in with its urinary tract blocked. Now, this is much more common in the male cat, but this female cat's urinary tract was blocked, and when we took an x-ray, in addition to seeing a really big bladder full of urine, we saw a large number of stones, and they really didn't look that big, but one was lodged right in the neck of the bladder, and it was preventing the kitty from being able to urinate. So we went to surgery, got the stone out of the urethra, out of the tube from the bladder to the outside, and removed all the stones. And the interesting thing is these stones were perfectly spherical. They looked like BBs. They were smaller than BBs, but I mean, you sit there and say, how does Mother Nature do this? How does she create this perfectly spherical stone? It doesn't look like the common stones that we see. The most common stones that we see are called calcium oxalate stones, or they're called struvite stones. Two different kinds of stones, but they're the most common. This perfectly rounded stone doesn't look anything like that, and so we're sending it in to be analyzed, and we send that to the vet school at Minnesota, where they have a registry with literally tens of thousands of stones that have been analyzed for the last 30 years, and so they are by far the most knowledgeable about, what might be causing this, what do we need to look out for, how do we try to prevent another one from reoccurring. So if I had to bet on anything, I would bet that this perfectly rounded stone, it sort of fits the description of what we see as a urate stone. And so it'll be interesting to see how that comes back, because those are hard to prevent from a diet perspective. But the interesting thing is urate stones don't usually show up on an x-ray. It did in this case. And then the other thing is that most of the time when a cat gets a urate stone, they have some kind of a problem with their liver. And this cat did not have a liver problem. So it's going to be really interesting to see how this comes back. And then we'll probably be talking to the people at the University of Minnesota about this and saying, this is a strange one. What do you think? I'll try to keep you posted. I'll try to remember to let you know what that stone was, and then we'll go from there. One of the great things that we sell in our retail space is a grooming tool called the Furminator. I would encourage you to Google it, and you can watch the video of the Furminator at work. You on one end and the dog on the other, or the cat on the other. But if you're having problems with your pet's hair matting up, if it looks like a snowstorm of hair where your animal has been, the Furminator might be the grooming tool that you need. It keeps the hair thinned out, and it gets the loose hair out of there before it has a chance to shed in the house, or in the case of the cat more than the dog, swallowing it during their grooming and then ending up with hairballs that they vomit in the house. And with that said, I would like to comment that most cats that chronically vomit, even if there is a little bit of hair or there is some hair in the vomitus, it's probably not hairballs causing that. And that's a problem that an animal should come in, the cat should come in for and have full physical exam and have it worked up for the cause of the vomiting. There's certainly no reason why you should have to put up with a cat that's vomiting around the house. Sometimes it's diet, sometimes it's an insensitivity to food or a food allergy, sometimes it's what we call inflammatory bowel disease, sometimes cats can get bacteria in their stomach called Helicobacter. It's the bacteria in people that causes stomach ulcers. And so they do see that as well, and sometimes we have to treat that. So, this is one of the reasons why it's extremely important that every cat, whether it never goes outside or it's outside all the time, every cat should come into the veterinarian once a year. There's no reason to not give your cat or cats that you have at home the same level of care that is sort of commonplace and accepted for dogs. The excuse that they never go outside is not a valid excuse, because cats are famous for hiding their signs of illness, and all of a sudden it creeps up on us and they're deathly ill, where if we'd seen them earlier, we'd be in a position to be able to do something about it. It's time to take a break, and we'll be back. We're going to talk a little bit about consumable treats. Consumable treats are rawhides, greenies, and other kinds of dental chews that the dog can chew, and so dentabones, those types of things where they chew them up. And certainly it could also include milk bones and some of those other treats that we use. But mostly we're talking about things that sort of carry a little bit of a bad reputation amongst a lot of people that they don't completely understand. But the keys to any kind of a consumable treat is to use an appropriate size treat for your dog. Don't give a Chihuahua a 2-pound rawhide, but don't give a Labrador a chew that's designed for a Portuguese water dog, because it's too easy for them to try to swallow the whole thing, and that's where we can get stuck. If you're using rawhides, use a big enough rawhide that they can sit and chew on it, and then if your dog likes to gulp things down as they get a little bit smaller, then it's time to pull it. There's no reason why you can't safely use rawhide, you can't safely use greenies or dentabones or any of those multitude of other treats that are out there, as long as you supervise when they have it. So don't give it to them when you're walking out of the house. If you're going to do something like that, then I would recommend that you get a Kong toy or a Have-A-Bite or one of the other kinds of chew toys with ropes and things. And we have a device at the office that's got a rope for a dog to chew on it. They pick it up and they chew, and then they shake it, and it's got a little container on, a little reservoir on there, and you can put dog food in it. It'll shake out a nugget of food, and then they're rewarded, and they'll keep working on it. So these are some ways that you can do it. A simple thing that you can do to occupy your pet while they're gone or slow their eating habits down: take a plastic Coke jug or a plastic Coke bottle or a water bottle, drill some holes in it, put some dog food in, and as they roll it and chew on it, then the pieces of the dog food will fall out, and they'll eat that, and it'll slow their eating habits down, and it'll keep them occupied so that they're less likely to get into trouble. There's more sophisticated stuff out there, including devices on timers that will open up and pop up and give them a little meal, every half an hour, every 20 minutes, something like that. So there's lots of stuff. The internet, in this case, is a great place to search for that kind of thing. But we're a big fan of products that aren't easily consumed, aren't easily torn off, aren't full of don't have bells in them, because if a dog tears a soft rubber toy out and then swallows that bell, we've taken a few of those out of stomachs as well. So be cautious as to what you use. If your dog has a chew toy, like a ball, make sure it's a hard rubber ball perhaps. Make sure that there's a hole in both ends. We had a dog once that was chewing on that and kind of chewing and sucking, and it ended up getting its tongue sucked into the hole on the top of this ball, and it caused serious damage. The dog ended up losing about the front 3 inches of its tongue because its circulation got impinged. That could never have happened if there was a hole in the other end, so that a suction couldn't have been created. Be careful about the things that you give to your dog to chew on. Don't give them stuff that looks like your new pair of Floorshimes, because we don't want those torn up either. So an old slipper is not really a good chew toy, because they can't tell old from new. We have 3 ways at Sylvania Vet that we can non-invasively do superficial growth removals, and growth removals that are just under the skin. Those growths that are just under the skin are lipomas. We talked a little bit last week, a couple weeks ago, I think it was, about doing liposuction. So yes, we can do liposuction to reduce a lipoma to almost nothing. We can do laser ablation. We've done that many times with a local in dogs that just don't need it because they're so calm. We can put a local in there, and we can use our surgical laser to just burn the thing away. The other thing that we can do is we can do cryosurgery. We can freeze the growth and remove the growth that way. And all 3 of those work really well. And there's something that should be thought about, so that your animal doesn't have to have heavy sedation or general anesthesia in order to have a growth removed. And we sometimes a lot of these dogs can get a lot of little bumps that look greasy and kind of like a cauliflower. Those are called keratinaceous cysts, and those are really responsive to laser ablation. I was driving out to a local restaurant. I'll give them a plug, Chow's, last night to have dinner with some friends for the holidays, and I'm thinking, holy cow, I had already decided I was going to talk about this on today's program. So lo and behold, what did we see? We saw a dog hanging out almost halfway out the window of a car. I can't tell you what a bad idea that is. Suddenly stopping or even suddenly accelerating might throw the dog out the window rather than back into the car. Cold air, the wind blowing can dry their eyes out. What happens to a bug when it hits your windshield? God forbid a bug would hit your dog. It's just plain and simply a really bad idea to let your dog ride when you're moving with its head out the window. The same thing is true about putting your dog in the truck bed of the car. In the cold weather or even in the really hot weather, putting them in a carrier in the truck bed of a car or the bed of a truck is just a bad idea. It gets too hot or it gets too cold and they can't stay warm, and it can get hyperthermia, which means they get too hot, or they can get hypothermia, which is almost as bad. Likewise, in the winter, we don't always think. We know that in the summer, the inside of the car can get really hot really fast, and the temperature inside the car can go up to 150 degrees real easy. But in the winter, on a sunny day, even in Northwest Ohio, the inside of the car can get pretty warm as well, and it would be too warm for your pet. So don't take your pet with you if you're gonna do some serious shopping, unless there's a protected place to park the car so that it's out of the direct sun. If it's out of the direct sun, we should be okay. We saw a dog late last week that came in, and the owners were fearful that the dog's time had come because its head was tilted and it was thrashing and it couldn't walk, it couldn't stand. Its eyes were bouncing all over the place. That's called nystagmus, when the eyes move in an abnormal way. And those kinds of things, balance mechanism problems, can occur because of an inner ear infection, can occur because of a stroke, surely. But in this case, what this was a case of what's called idiopathic vestibular syndrome, IVS. And IVS will certainly mimic a stroke, but the good news is if you give it 48 hours, they almost always start to improve. And it's pretty rare that they don't get to the point where they can go home and be fully functional and walk. Sometimes they have that little head tilt that remains, but their eye movement stops and they settle down and they live happily. And I've had dogs that have lived several years beyond their first episode of IVS, and I've had dogs that have had more than one episode of vestibular syndrome, and they still continue to recover. So that's really a good thing. Another thing to talk about is that we think all the time about dogs and as they get older about arthritis, but rarely do we think about cats and cats getting arthritis. But I will tell you that cats do get arthritis, and where in dogs, the arthritis is more common in the back end, hips and knees. In cats, the most common place for arthritis, it can occur in hips and knees, but the most common place is their elbows. And so it's tough for them to get around. It's tough for them to jump down because it hurts every time they do that. There's no safe aspirin-like drug for us to give to cats long term. So we have to look at other ways to manage their arthritis, and weight control is an important thing, but then using some kind of a joint sparing product can be beneficial. So we recommend 4 different things: Duralactin, Dasaquin, omega-3 fatty acids, which come in either a capsule or a liquid form, and then an injectable called Adequin. And all those products will help. And I've had some cats over the years that really were incapacitated. When we started giving them Adequin injections, they did extremely well. Okay, well, I'm going to take a break, and we'll be back. Well, here we are. We're going to put a wrap on the old year and get ready to welcome the new year in. And so, again, I'm going to wish you a Happy New Year. The question came up to me, what's the best litter for a cat? And there is no great simple answer. There is no one size that fits all. There's no great way to tell you what is the best litter. But what I think is true is that the best litter is litter that you keep it simple and you follow the KISS principle. And if you buy litter that's not adulterated with any odor neutralizers or deodorants or anything designed to cover the scent of the urine, cover the scent of the feces, and you rely on cleanliness, that's the best litter. So there's a lot of them out there that have all kinds of additives. How do you sell a bag of dirt if you don't do something? And so the key is it'll usually be cheaper if you keep it simple. Just yellow sand like you get from the sand pit. You probably don't want to use that because it gets tracked around the house and it's a little messy. But it's really great because it's just like what the cat would want to go in out in Mother Nature. So that's an excellent one. But the unadulterated clumping litters like Everclean, great product. We've had a lot of success in animals who were pottying outside the box when we got them onto Everclean and other products like that. They stop pottying outside the box. So that's one simple solution for one of the really common problems that we see cats. We do a lot of nail trims, particularly nail trims in dogs. Even if the dog's cooperative, it's a two-person job, and our insurance company and the insurance companies of most veterinarians and most groomers won't allow owners to hold their animals because of liability. As a two-person job, we have to do it, and then if we have an animal who's a little bit difficult, it can take quite a bit of time. So the fees for nail trimming can be more expensive than seems reasonable. Well, our solution to that is that we have a nail trim card. You can buy a nail trim card, which is 10 nail trims, and it reduces the cost of the nail trim by about 40% when you buy that. So, if you're frequently having your animal's nails trimmed, come in and think about buying a nail trim card. I think you'll be happy. We know how to restrain your animal so that it's not a war. We know how to do it in a way that it's hopefully a positive experience for your pet. So the next time it's easier and less stressful for your dog. That would be the worst thing that we could possibly do, is to make things worse for your pet. And don't ever hesitate to okay the use of a muzzle. We find that a lot of animals will calm down and be much more manageable and much less stressed if they have a muzzle on. So feel free to say it's okay to use a muzzle if you need to. It's not a bad thing. It is something that we do a lot of because we find that the bridge of the nose and the back of the head are submissive pressure points. It has a really calming effect on dogs and on cats for that matter as well. Want to remind you, very soon, I wish I had a deadline to announce today, and I don't, but we're going to be a part of the TV 13 Get Connected. We're one of 13 local professionals that have been asked to be a part of that, and we're really proud to be it. It's going to be a great video that we've just about put the final touches on, and I expect by the middle of January, we should be in pretty good shape. An adopt-a-thon is scheduled for Sunday, January 13th from noon to 3 at Sylvania Vet. We encourage you to come. Again, this is a great time that if you've been thinking about getting a pet for the holidays for the family, this is the time to get it, not before Christmas, not when the Christmas tree's up. Get all that hectic out of the way so that you can devote as much time as possible to bringing the pet into the home. So this would be a great time to come and look for that holiday pet. Every Sunday, including this one coming up, tomorrow is Zumba at Sylvania Vet, 3 o'clock. Just show up. You can be a part of the Zumba class. There's a fee, but it's $5 for clients that want to come, and you'll have a lot of fun. Sarah Adams teaches it. So I'm going to wish you a very happy New Year, productive New Year, profitable New Year. Thank you, Sylvania Vet and Elanco. And there's only one greatest pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.